Governor Holcomb's briefing will begin in 2 minutes. For the journalists joining us in the digital press room, if you'd like to ask a question, you can click the Raise Your Hand button. When you are called upon, we will unmute your microphone, and then you also will have to unmute your microphone.
Good afternoon. Thank you for joining us, hopefully once again. Just to put on your calendar as we look forward, we were able to meet twice this week, and projecting out leading up to hopefully stage 4, which is a Sunday, June 14th. We'll plan on being here next Wednesday and next Friday. Worked fine this week, so we'll try again twice to come together next week, and then we'll meet again twice the week after that, first 2 weeks in June. So Wednesday, Friday, Sunday the 14th. We'll reassess long before that to determine how often we'll meet in the coming weeks before we hopefully get to stage 5. So with that, we'll get to stage 4 or stage 5 on the numbers that you share with us and that roadmap, and I'll turn it over to Dr. Box now.
Thank you, Governor. Good afternoon, Hoosiers. Today we reported 521 additional COVID-19 cases in the state of Indiana, which brings to the total of number of Hoosiers that are known to have COVID 33,558. We unfortunately saw an additional 40 confirmed deaths. To date, 1,946 Hoosiers have died of COVID-19, and another 164 are believed to have died from this disease based on their clinical diagnosis. We also have seen nearly 249,000 Hoosiers get tested for COVID-19, which is up from 208,000 just a week ago. This includes nearly 27,000 from our statewide testing sites, still running about a 5% positivity rate with our statewide testing sites. Many sites still have capacity. Let me repeat that. Many sites still have capacity. So if you are a business and you're concerned about your workers' health, or an individual returning to work, or an individual with symptoms or an individual who is at high risk, use these sites so that we can maximize this testing. We continue to maintain our ICU bed and ventilator capacity with nearly 38% of our ICU beds and nearly 83% of our ventilators currently available. About 16% of our ICU beds are occupied by COVID patients, and about 5% of ventilators are being occupied by COVID patients. We have the latest data from our partners at Regenstrief to share regarding hospitalization and recovery. We looked at 32,548 cases. Of those, about 26% visited the emergency department, down slightly from 1 week ago. A total of 5,678 were hospitalized, which remained steady at about 18% of all the positive cases. Of those who were hospitalized, 21% were admitted to the ICU, which is down slightly from the prior week. 72% of patients have been discharged. Of the remaining 28%, Nearly 18% are known to have died while they were hospitalized. The remainder are still hospitalized. Regan Street also estimates that 63% of patients have recovered, which is an increase from 60% last week. I also want to remind Hoosiers that Phase 2 of the IU Fairbanks School of Public Health research study starts next Wednesday. Hoosiers may have already received a postcard inviting them to participate, or an email or a text with a message from Governor Holcomb. These are legitimate invitations, and we ask you to please participate, even if you've already been tested. We need your participation to ensure the researchers accurately capture the scope of COVID-19 across our state. We expect to see the next analysis of these results the week of June 22nd. Finally, I want to correct some misinformation that I've seen circulating about COVID-19. Some people think that this is only a disease of elderly people because of the terrible toll that we have seen that this has taken in our elderly age group. I want to remind you that 45% of individuals tested in the first wave of the Fairbanks study were actually asymptomatic, and they had no symptoms of COVID-19. I also want to point out that anyone can be at risk of getting COVID-19. In fact, 31% of our cases, nearly 92% of our deaths, are among people aged 60 or older. But 34% of cases were the ages 40 to 60. That means another third are under the age of 40, including 19%, or nearly 1 in 5, who are under the age of 30. If you think this risk is over, you're incorrect. And the choices you make today could put someone else at risk of serious illness or even death in the future. So please, continue to wear your mask and practice social distancing, no matter what your age is. We also are getting a lot of questions from places that want to hold big events with thousands of people after July the 4th. I want to caution Hoosiers that this is an evolving situation that we're still monitoring every day. The 5-stage plan to reopen Indiana depends on the data that we receive. And as the governor has said, we will make adjustments based on what those numbers tell us. Currently, our guidelines allow for gatherings of up to 100 people. The plan at this time is to allow gatherings of over 250 after July the 4th. But remember, that's dependent on how well we do as a state over the next month. And it still requires us to follow CDC social distancing guidelines. And so I ask people to remember that we are working toward a new normal that will not look like things did even 6 months ago. And we still need to take steps to protect our most vulnerable Hoosiers. Thank you very much.
Thank you, Dr. Box. Secretary Schellender, Dr. Box always and rightly has focused on how the COVID-19 has adversely affected our lives, and your Chief of Staff, Luke Basso, are focused on our livelihoods, how those are both intertwined, and you've got some good updates on where we are on that front.
I do, Governor. Thank you, and good afternoon. On behalf of the Indiana Economic Development Corporation, we know that this continues to be such a difficult and challenging time for our businesses all across the state, employees and employers alike. And that's why it's such an honor today to join the governor to talk about several relief and recovery resources that are available to Hoosier businesses throughout the state. But first, I want to update you on the Paycheck Protection Program that's offered by the Small Business Administration, an amazing program that is helping with disaster assistance. To date, Indiana businesses have received more than 70,000 Paycheck Protection Program loans totaling for almost $9.5 billion. Small businesses coming from all around the state have received PPP loans, and we encourage you to continue to do so, as there's still $189 billion available through the Paycheck Protection Program at the federal government level. So contact your local banks, your credit unions, contact the Small Business Administration at the federal government, or contact the Small Business Development Centers at IDC, and we'll help you through that process. It's a quick process, and the money's made available very quickly. In addition, we've received 5,000 economic disaster loans totaling more than $445 million for our businesses through the Economic Injury Disaster Loan Program, and we received more than 38,000 loan advances through the Economic Injury Disaster Loan Program, totaling more than $136 million. times. And today, I'm pleased to announce a new program that's available to eligible Hoosiers, small businesses, we refer to as a Small Business Restart Fund, which was recommended by our Indiana Economic Relief and Recovery Team. Governor Holcomb has approved $30 million from the Federal CARES Act to support small businesses in restart grants. These are grants, they're not loans, helping accelerate the speed of economic recovery activity by providing working capital to cover certain expenses related to the pandemic. This program is designed for businesses that are unable to secure the Paycheck Protection Loan Program for any number of reasons. Small businesses with fewer than 50 people that do less than $5 million in revenue are eligible for this program. If you've had a 40% drop in revenue, you will be eligible to be reimbursed for up to 80% of qualified expenses, such as rent, mortgage payments, utilities, lease payments, real or personal property, and safety investments such as PPE and infrastructure. Eligible small businesses must demonstrate that they've had a revenue loss of at least 40%, and if you do, you will be eligible for up to $2,500 a month for 4 months, or a total of $10,000. For small businesses that have experienced a drop in 80% of revenue, you will receive up to $5,000 a month, again, up to $10,000 maximum. Of the $30 million that's allocated for this Back It Startup Fund, $5 million of it will be dedicated and reserved for certified minority businesses and women-owned businesses. But again, you can access this by going to backontrack.in.gov. But I want to again emphasize, please look at applying for the Personal Protection Loan Program. It's a great program, and again, it's a grant that you don't have to pay back if you keep your employees retained. So we want to maximize those so that we can maximize this startup program for small businesses to those that are not eligible for the Paycheck Protection Program. Additionally, I wanted to note that the Small Business Development Center has received nearly $3.7 million of U.S. small businesses from the U.S. Small Business Administration through the CARES Act to support increased resources for Hoosier entrepreneurs and small businesses over the next 18 months. This is almost double what we normally receive in that funding, the annual fund of federal fund of appropriations, and this is going to enable the Small Business Development Centers in Indiana to increase at no cost services such as counseling and training for our small businesses that are impacted by the COVID-19 virus and pandemic, financial assistance, e-commerce, business adaptation and innovation, and disaster resilience and reopening plans. The services will be delivered through our 10 small business development centers throughout the state. And again, contact backontrack.in.gov. We're excited about this program, and we're here for you to continue to help you thrive during these very, very tough and challenging times. And with that, I'd like to turn it over to my Chief of Staff, Luke Basso, who is going to announce some other updates with our PPE program.
Thank you, Secretary. Thank you, Governor. Luke Basso, Chief of Staff, IEDC. As you both often say, Indiana has long been a great place to make things, grow things, and move things. Many things have been changing the competitive landscape, especially in the manufacturing sector, with the introduction of smart manufacturing trends. This is why our team has worked hard over the last year to design creative programs to support Hoosier businesses. Then the COVID pandemic happened, introducing new sets of disruptive factors like unreliable supply chain, shortage of critical medical supplies. With a new set of facts and an even higher sense of urgency, our team recast several programs, and today I'm pleased to announce the Economic Activity Stabilization and Enhancement Program, otherwise known as EASE. In response to the global COVID-19 pandemic, the Indiana Economic Development Board of Directors approved $10 million that are designed to support Hoosier manufacturers for a new set of challenges. These programs will launch later this year and are intended to be long-term solutions for the state's manufacturing industry. EASE encompasses 3 initiatives, all designed to stimulate manufacturing investments and Hoosier operations. These 3 initiatives include a new smart and advanced manufacturing focus fund, which will make early-stage investments and provide entrepreneurship resources to Indiana manufacturing-focused startups, manufacturing readiness grants, managed in partnership with Connexus Indiana, will provide matching grants of up to $200,000 to companies. To be eligible for the grant, companies must commit to modernizing their operations with smart technology and process, or invest in healthcare manufacturing technology, such as making PPE. Finally, a smart manufacturing studio lab, which will provide lab space and access to state-of-the-art manufacturing equipment. The IEDC is excited for these programs to launch and to continue to help Indiana's economy grow. Now I'll provide you with an update on the PPE in the marketplace. To date, the state has ordered more than 18.9 million pieces of PPE, and we have received over 15 million pieces. I would like to thank Midwest Constructors, which has joined our growing list of businesses and organizations helping with the state receiving the proper PPE. As for the marketplace, we have now received and delivered over 25,000 orders statewide. If you're still having issues finding PPE, please utilize the marketplace to help your business reopen safely and reopen on time. Thank you.
Thank you, Luke. Thank you, Mr. Secretary. Exciting stuff. Fred, you have your weekly Department of Workforce Development update.
Thank you, Governor. So as we have seen, our weekly claims filings have declined week over week since our peak back in March. For the week ending May 23rd, we saw 26,278 initial claims filed. We've also seen a total of 1.3 million unemployment insurance payments made in the month of May, totaling close to $1 billion. Since March, our unemployment insurance program has paid out $1.79 billion. The breakdown includes $519 million in state funds and $1.3 billion in federal funds. Our added technology and staff have helped us to continue to reduce the call wait time in our call center. Over the past 4+ weeks, the call wait time has been reduced by 75%. We continue to average 80 to 85% of claims going from filing to payment within our average of 21 days. We've done this by utilizing our focus plan on maximizing automation and technology and increased staff and maturing that staff to handle the more difficult claims. Those claims that go beyond 21 days require more experienced adjudicators to work through the processing. Our responsibility is to ensure that every single Hoosier who's eligible for unemployment benefits receive payments. We'll continue to work to do that. I was reminded earlier this week just how important public awareness of fraud is in our last press conference. So I wanted to spend just a couple of minutes talking about fraud. Fraud has always been an unfortunate part of any transactional system that involves payment. Our unemployment insurance system is no different. We have certain processes and checks and balances in place to avoid fraud. But our best allies in our defense against fraud are claimants and employers. As a claimant and as an employer, if you see something suspicious, let us know. While no system is 100% foolproof, we take precautions to make sure that our system is protected to the best of our ability. With your help, we have and will continue to thwart fraud attempts. But here are a few tips that you can help us with. A few tips to help avoid fraud. 1, avoid sending personal information like complete social security numbers and dates of births. Avoid sending those things to groups of people via email. Avoid sending similar information or posting it on social media. And avoid disclosing banking information. All of us can play a part in preventing fraud. As a reminder, our agency is responsible for connecting individuals to resources. Those resources include job training, connecting them to jobs, connecting employers to a skilled and educated workforce, in addition to what's most prevalent with us right now and most important is connecting individuals to their unemployment insurance benefits. Along the job front, we continue to have virtual job fairs for jobs throughout the state. If you missed one of those job fairs and are interested in catching some of the back recordings, you can catch them or follow us or look at them on our website at dwd.in.gov. We'll also share more information in the future with you regarding our Rapid Recovery Action Plan for opportunities to support Hoosiers, securing jobs, and growing their skills and developing talent. In closing, I'd just like to remind us that we've seen hundreds of thousands of claims filed, while we're seeing over $2 billion or close to $2 billion in payments made. We'll continue to work through all claims filed, make payments to every eligible Hoosier, but we'll also continue to help Hoosiers seeking additional training and jobs so we can ensure that we come out of this pandemic in a better position than we came into it. Thank you, Governor.
Thank you, Fred. Rachel, let's just jump right at the questions on people's minds.
Whitney Downard, CNHI.
Good afternoon, Whitney.
Good afternoon. My questions are, I have two questions about nursing homes specifically. Earlier this month, May 18th, I believe, you sent out a survey to long-term care facilities asking them how they would test all of their staff and residents, and you have a goal of having everyone tested within 2 weeks. What is your plan, and when will the results of that survey be public so we can kind of see what that plan is? And then my second question is, on Wednesday, Dr. Dan said that strike teams only identify some residents for testing. Why not just test all residents and staff for the virus?
Two good questions, Dr. Dan.
Yeah, thanks so much. Dan Rosiniak, Chief Medical Officer for FSSA. So the survey that we sent out to all long-term care facilities, it was actually just to skilled nursing facilities. And that was a survey to help us determine what the feasibility would be and what would need to be in place to do testing of just staff in long-term care facilities. So we sent that out a little over a week ago and are still currently analyzing that, trying to determine if we were going to do this as a state, if we were going to help long-term care facilities and using the resources that are currently in the community, both with Optum and other sites, how would that look? And then based on those results, we're going to work internally to see what might be feasible for us. I think the focus on testing long-term care staff particularly is the direction and the right direction for us, since we really know that when we see outbreaks, it's most likely, in most of the cases we see, that it's a staff who has COVID-19 and doesn't know it, who might be working in those facilities. So like other states, looking at ways that we could better proactively identify that is our goal and is what we're working on right now. In terms of releasing that, I don't know that we had specific plans on releasing that data, but we'll certainly talk internally and with our communications director about that. In terms of testing everyone, so in part that's what we do. So we're fairly targeted in that if we see an outbreak in a long-term care facility, we do go back in that facility and test everyone that would have potentially been exposed in that facility. And we have and are still moving towards that and doing more of what we call point prevalence surveys in facilities. So if we see there's an outbreak, going in and helping that facility to be able to test all of the residents. So that has been the approach that we've been doing. And will continue to do. And the importance of that is that lets that facility and us know who has COVID, who doesn't have COVID, which really helps them to appropriately separate those who are positive from those who are negative.
Thank you, Whitney and Dr. Dan.
Adam, WFIU.
Good afternoon, Adam.
We'll return to Adam. Eric Berman, WIBC.
Good afternoon, Eric.
Hello, Governor. My question, I think, is for Jim Schellinger, though feel free to jump in here. I'm hoping you can offer some more details on the small business program. Specifically, we know we've lost some businesses already, particularly restaurants. How many businesses will this actually keep afloat, and how will it do so?
Well, we have 700,000 small businesses in the state of Indiana, and we have approximately 160,000 of them that are 50 or less employees, which this program is available for. And it doesn't matter what market sector it is. It could be retail, it can be hospitality, manufacturing, whatever it is, personal services. So this is it meant to help them with their expenses over the next several months, their real hard expenses, fixed expenses, to help them be able to focus their funding on other things that help their business thrive. So we believe that there are a lot of small businesses out there that have not qualified for the Paycheck Protection Program, given for whatever reason that might be. And that's why we want this $30 million program to help those small businesses, and we'll reassess it just as the Paycheck Protection Program did when it ran out of funds from the original $349 million. We'll reassess this as we go based on demand.
Yeah, and I would just say this is both meant to be a lifeline to those businesses and a bridge, quite frankly. And we want to make sure that we're hearing from every single one of those small businesses who qualifies.
Elizabeth Binion, WNIT Public Television.
Good afternoon, Elizabeth.
Good afternoon. A viewer wanted us to inquire about how he can see the Westfield Prison COVID-19 data on the state dashboard. Is there a way to isolate positive cases and deaths by a specific facility? And secondly, many of us were concerned about the images we saw last weekend of people crowding into Indiana beaches, restaurants, and pools without masks or social distancing. Is there something specific the state can do to prevent this type of crowding that Dr. Box referenced at Wednesday's press conference?
Dr. Doss, you want to take, or Director Carter?
Kristen Doss, Chief Medical Officer for Indiana Department of Correction. On our website, our state website, IDOC's, Indiana Department of Corrections website, we list every single day staff who are positive, staff who have been tested, as well as offender information regarding COVID. So who's in isolation, who's in quarantine, deaths, all that information is listed, and it's broken down by facility, and like I said, updated every day at 1 p.m. If there's additional information that you're requesting or need or you can't find at that site, please send our communications team an email and we'll get it to you. Thanks.
Thank you, Dr. Doss. Director Steve Cox, you want to talk about our relationship with local communities in terms of not just enforcement, but education, and how our habits and our routines and our behavior affects the stages to come.
Absolutely. Thanks, Dr. Binion, for that question. I would just say that Department of Homeland Security and ATC have both been partnering with local agencies, the State Fire Marshal's Office and local fire marshals, to make sure that we're providing education and encouragement to those business owners, restaurants, retailers, et cetera, to make sure that they understand not only what the executive order from the governor has put in place, but also giving them the information on the CDC guidelines as far as social distancing goes and how to safely conduct their business. So far, we've had less than 100 complaints throughout the state in regards to occupancy issues. Our state fire marshal's office has only had, I believe, about 22 complaints statewide in phase 3, most of which we've already been in touch with the local entities to be able to address with those business owners. And so we've been in contact with them to be able to provide that education and encouragement. As it stands right now, we have not had to give any verbal warnings or any cease and desist orders in regards to occupancy issues. For the most part, most businesses that we've been in touch with have been very compliant and have wanted to go ahead and implement those measures that we've educated them on to make sure that their customers are safe.
Thank you, Steve. And hold on, I'm going to call an audible. And Joe, why don't you, Steve just reminds me about an update on numbers, and I promised you would have an update this week. Can you give us just a minute or two?
Good afternoon, Joe Herons, General Counsel with the Governor. The numbers, to follow up on the comments from Wednesday, I do have updated numbers that give a comprehensive look at the enforcement effort. Let me start with just the aggregate numbers current as of yesterday, going back from the start of the enforcement effort a couple months ago to the present day. Those numbers are, there have been a total of 1,867 complaints, of which 1,686 were deemed unfounded. There have been 156 total verbal warnings and 1 cease and desist letter. I want to give you the numbers on stage 2 and stage 3, which are within the aggregate numbers, but I thought you would like to see how we're doing in the various stages. During stage 2 of the Back on Track order, which started on May 1st, the state task force investigated 361 complaints, of which 328 were unfounded. There were 25 verbal warnings and 1 cease and desist letter. During the last 7 days of stage 3 that we're in now, that started last Friday, May 22nd, there have been a total of 67 complaints, of which 36 were unfounded. 5 verbal warnings were issued, and there have been no cease and desist letters issued in stage 3. 26 complaints during the stage 3 period are currently pending, meaning that they have not yet been investigated or are awaiting further information in order to complete the investigation. And so that is the total information on the various stages 2 and 3, as well as an overall look going back to the start of the enforcement effort.
Thank you, Joe, very much.
We'll return to Adam from WFIU.
Afternoon, Adam.
Hey, good afternoon, Governor. Sorry about the technical gremlins there. This is actually a question for Dr. Box. We've seen some cases of COVID-19 flare up at businesses like meatpacking plants. Does the state do anything to track those, maybe contact tracing, and if so, do you have any available data on that?
We don't have aggregate data that we're putting on our website or anything with regards to that, but the State Department of Health is very actively involved in those cases as long as individuals reach out to us. We are looking through contact tracing and through our local public health individuals at several cases that would pop up in a certain, say, meatpacking plant or a lighting company or, a Tyson plant, and we do investigate those further. Many of these companies or businesses have been reaching out to us, sometimes not necessarily because they have sick individuals, but just because they would like us to look over the particular things that they have put in place to try to prevent infection and to kind of have us, give our recommendations if there's anything additionally that can be done. But we do oftentimes engage in doing some initial testing, sending individuals to some of the Optum testing sites, and then following up. And oftentimes our local health departments are engaged very much within the community.
Matt McKinney, WRTV.
Hello, Matt.
Good afternoon, Governor. My question here, Marion County Clerk Maya Eldridge sent a letter this week to Secretary Connie Lawson saying that thousands of Marion County primary ballots could go uncounted if the deadline for the election board to receive those ballots isn't extended past noon on Tuesday. So would you support extending the deadline, and how concerned are you about the potential of thousands of uncounted primary ballots?
Well, I think I'm not a doctor, I'm not an attorney, so Joe Herons is listening to this, fortunately. I'd want to look at this statute, obviously, that's in place. Sounds like to me, just in reaction to your question, without having put any research into it, it's probably something that would go in front of the Election Commission. Understand the time sensitivity here. The good news is I hope that our Secretary of State, Connie Lawson, is with us as well, and she might want to comment on this very question as well. Secretary Lawson, are you with us?
I am with you. Can you hear me?
We can, crystal clear.
All right, thank you. And I apologize for not being able to be with you personally this afternoon. Extending the deadline really is not going to help someone who has not received their ballot. And so in that letter, Marion County stated some solutions that I thought were very reasonable about, turning in your ballot at the early voting and on election day. There'll be 22 locations plus the city county building. People can personally turn in their ballot. I would, as you might recall, the last couple of times I've been with you, I encourage people not to wait until the last minute to request that absentee ballot. A lot of people did. We could see from the volume, and that's no excuse. I know that Marion County worked diligently, and I, in fact, personally called Mayor Hogsett and asked him if he would get the Marion County clerk some help to get those ballots out. I left that conversation feeling very good and positive about what he was going to be doing. And I think they've made every effort to get them out in the mail, but there's also mail processing that we cannot control. But I still believe that, changing the deadline would not be a good idea. There are 92 counties in this state, and we cannot change deadlines because somebody is too busy or whether it's lack of preparation of getting the work done. So the deadlines are there for security and accountability.
Well, and Secretary Lawson, you mentioned last time you were at this table in person, the multiple options to vote, and that the election sites will be properly equipped and safe to vote in person as well. That's what I'll be doing. But all those sites, Secretary Lawson, have the proper PPE on June 2nd as well, correct?
That's correct. The poll workers will have the PPE. Voters will be offered hand sanitizer if they like. We encourage voters to wear a mask, obviously, as they would wherever they went. And voters have some options still. Number one, they can, if they receive the ballot and they don't think it will be received by the county in time, they can go to a polling location. They can fill out a form that's called the ABS-5, and they can surrender the ballot and vote in person. They also can go to a polling location and turn that ballot in. So they do have options. Unfortunately, these are unprecedented times, and we have had 579,249 voters apply for an absentee ballot. And the good news is most of those ballots are in the voters' hands, and we've had at least 60 to 75%, depending on the county, of those ballots being returned.
And just to be clear, you mentioned the 22 polling sites, and you're just referring to Marion County for those 22, correct?
That's correct.
Right. Perfect. Thank you.
Kathy Treader, Ferdinand News.
Afternoon, Kathy.
Afternoon. Nice to talk to you on this Friday.
Good to be with you.
I have two questions, one for Dr. Box and one for you. So I'll start with yours, Doctor. I know in New York, one of the hospitals tested every pregnant woman who came in to deliver. And of those 15% tested positive, but 88% showed no symptoms. And that started me thinking, I don't know if any hospital is doing that kind of test or if any doctors are doing it with their pregnant patients. But is there any evidence that that COVID would be passed on to a fetus or to your unborn child? Have there been studies on that as of yet?
They are just now in the process of starting to collect cases with regards to pregnant women and newborn children. The thought process based on other diseases is that for sure the antibodies, if a woman is actively infected with COVID-19, would cross the placenta to the baby and give the baby some protection at the time of delivery. And that's why normally we would encourage things like breastfeeding afterwards to help. With regards to whether there have been babies born actually infected with COVID-19, I don't have any data or any information with regards to that, but I do know that the CDC is actively collecting these cases now, and so here in the state of Indiana, we're also looking into that. I will say that I think that there are some hospitals that are actively testing women when they present to the labor and delivery unit. They are very much limiting the number of individuals that can come to labor and delivery, so only one support person with each pregnant patient. And even after delivery, grandmas and grandpas, aunts and uncles are not allowed to come. And that's heartbreaking, but that's not unusual in things like a severe flu season for us to have to do that.
And then Kathy, you had one for me?
Yes, I had one for you, and I know you have no crystal ball, but this I don't think you need a crystal ball for. So many communities rely on grants, like the community crossings that we had in the next level, and a lot of Okra grants to get things like sewer and water projects done. Do you see, because of the revenue shortfall, that's probably definitely going to happen, do you see?
Oh, it's happening. Yeah. It's happened, past tense.
Right.
Yep.
Do you see some of those programs going away? I'm sort of thinking for community preparedness, whether they need to be thinking of looking elsewhere, especially those Okra grants.
Well, we're working on that right now, and we'll continue to. And I see the budget director swirling like a shark here, making his way toward the podium, hoping I don't say anything that he just had a meeting about 2 hours ago. But your question is very timely, and it's going to continue to be timely as we look at the numbers come in, as we see the revenue month by month. Everything is on the table. However, I mentioned we don't want to be counterproductive to anything that has to do with our COVID response, number one. Number two, in terms of some of our road projects that you brought up, we've gotten funding out to counties so that construction could continue. And matter of fact, we're saving money while we're being able to do these quicker. We'll have more information on our next level connections in terms of, and we've been down your way, Kathy, as you recall, not too long ago, a few months back, in terms of rural internet broadband connections. And that program will have more. We received another probably record response in terms of the next round for our rural broadband plans. And so that program continues. So we'll look at every single program. The only thing that we've talked about so far is just going to all of our state agencies and asking for their ideas on how to not just freeze employment levels, but also find about 15% savings from agency to agency. So as we work with our friends upstairs in the legislature, putting together the next budget, a lot of these questions will be answered, but that'll be later this year. Chris, you want to talk about some other grant programs that she specifically brought up?
Right. Chris Johnston from OMB, and thank you for the very glowing introduction. But yes, we certainly in state government, we administer and distribute a lot of different funding streams, from road projects, the local option income tax, and other distributions. And so the governor really summarized it well, and that is the economy is going to take its toll on all those revenue streams. And so we're being very deliberate in our evaluation of what not only the current outlook is, but then the uncertainty. And we realize the uncertainty is what creates the anxiety out with local units of government. I think the thing that we can say to those local units of government is that as soon as we know the direction that we will be heading, the important thing is to communicate with those local units, and we pledge to do that as soon as we're have the clarity to make those decisions and move forward with those funding streams.
Chris, before you, can you talk just a little bit about our municipalities and our counties and what they've submitted so far in terms of COVID-19 expenditures?
Sure. We set aside the $300 million for local units of government. The program's been available for about 10 days to 2 weeks. Right now, there's just been a lot of inquiry regarding the process of what needs to be submitted for reimbursement. The first reimbursements went out to the trustee to send those out today. There were only 3 that were approved this week, but I think it's about $50,000. The other thing that we are doing is coordinating with Department of Homeland Security with the FEMA reimbursement. There's been a little bit of an interesting twist that we're trying to sort through from the federal government, that the relief funds, some of the resources that state government has, could be used as matching funds for the FEMA dollars. And so I think that has maybe paused everybody to think through what they're submitting to make sure that they, just like us, they're maximizing the funds that are available to them. So we think, based on the level of questions coming in, the actual reimbursements will pick up in the coming weeks.
Meaning that they and we are going to FEMA first before moving on to this other pot. So
well, just looking at the best route available, and also the most expedient route in order to get the funds available or out to them as soon as possible.
Thank you, Chris.
Kayla Sullivan, WXIN.
Good afternoon, Kayla.
Good afternoon, Governor. I have 2 questions. When do you plan to make the call on whether the November election will be a no-fault absentee ballot election? Considering complications counties have seen in this primary, I know clerks would appreciate the maximum amount of time to prepare. And then also, have you been in contact with other governors, including the governor of Minnesota, about how to handle protests right now? How do you plan to protect Hoosiers and local businesses if protests break out here in Indiana?
First question, I don't have a date specific in mind. We'll get through the primary before we get to the general. We'll have time to do that, but I understand your question and how quickly time does unfold. But we'll be prepared, and obviously we'll be in close contact with Secretary Lawson. And Secretary, you might want to weigh in on this question before I get to the second one too, but she'll obviously also be in contact with the major parties here in the state of Indiana as November draws closer. Madam Secretary, do you want to add anything on this front before I move to the second question that Kayla had?
I think you said it correctly. We need to get through this primary, and then we'll see where the state is as far as COVID goes. And we'll have conversations with both state parties and our county clerks and election administrators to determine which course we need to follow in November.
Thank you. Your second question, yes. As early or as late as earlier this morning, I did speak with Governor Beshear and I spoke with Governor DeWine. They've had some issues recently in Louisville and in Columbus, Indiana. There is no easy, or excuse me, not Ohio. No easy answer, obviously. Whenever we see issues like this flare up, I try to channel April 4th, 1968. To be quite honest, we have an example front and center here in the state of Indiana when Bobby Kennedy happened to be in the state of Indiana when he learned that Martin Luther King was taken from us, and his eloquent and iconic words not only landed but connected with people and really caused us to think about what would calm the waters and what would bring about peace. I think it's injuring the innocent in a response to an injustice is counterproductive. And I'm looking and appealing to people to find it in the goodness of their heart to be part of the solution here and not part of the problem. And it can be tough when you see injustice around you. I get it. And you can be very reflexive and very reactionary. But I would just ask folks to take a breath and to be part of the solution. We are experiencing unprecedented times together here in the state of Indiana. And there is some beautiful acts of kindness coming out of it. And there, of course, is a full spectrum. And on the fringes, there will be some bad actors, and there will be some professional protesters. I very much respect our First Amendment to assemble and to speak and to be heard and to voice your opinion. And we'll continue to be respectful on that front. But I ask you to do it peacefully. It will be heard. Simply increasing your volume does not increase the validity of your argument. And so let's get through this thing together. It should not be a perfect storm to air out all of our grievances all at once. We need to take them on. And Indiana has proven since early on and through the decades, including Bobby Kennedy's words right there at Kennedy King Park here in the capital city, that we can and we must do this if we're going to honor those who we lose.
Angelica, Wayne TV.
Good afternoon, Angelica.
Hi, Governor Holcomb. My question is with regards to surprise billing. There's been concern over this for quite some time. Can you talk about what, if any, measures are being taken to move legislation forward that would eliminate surprise billing in the state of Indiana, especially in the midst of this health crisis?
I don't know where the measures stand right now. I do know it was a big discussion with our legislators, and it is not something that has dropped going forward. It is very much a concern that someone goes to a particular clinic or a system where their health care insurance covers that, and then unfortunately they have a particular radiologist or someone who reads that particular film that is not covered, and then that ends up being a surprise bill to them. And I don't think anybody wants that to happen anymore. So I know that our hospital systems have been working very, very hard on that. But Governor, you may know better than I know.
That's where we are.
Alex from Bloomberg.
Good afternoon, Alex.
Good afternoon, Governor. This question is for Secretary Schellinger and Mr. Basso. Could you expand a little bit on the incentive that you talked about earlier? That's what it seems to help with manufacturers onshore and produce more materials that would be useful for PPE and other healthcare related infrastructure. The reason why I ask is we've been sort of looking into and tracking these sorts of incentives around the country. We want to hear more about what the state is doing.
Thanks, Alex. Luke Basso, Chief of Staff, IEDC. Yeah, so part of the $10 million that we've announced in EASE is up to $200,000 matching grant for companies that are manufacturing healthcare manufacturing technology, which would include companies making PPE. So you saw an announcement today from the IEDC that a company in northern Indiana is purchasing 2 N95 respirator mask machines. That would be something that would be eligible for this grant program. It's manufacturing that has been done overseas that is now coming back to Indiana, so that would be eligible. Also, companies who maybe don't have a line today, but they want to, start a new line that would include PPE or other smart technology, they would also be eligible for the program.
Thank you, Alex.
Lauren Chapman, Indiana Public Broadcasting.
Good afternoon, Lauren.
Good afternoon, Governor. How's it going?
Very good, thank you. Yourself?
Not bad. So I've got a first question that is for either Secretary Schellinger or Basso, and then I've got a second question for both you and Dr. Box.
Okay.
So first question, I don't know who's it's best for, but you've highlighted the Indiana companies that have donated PPE and the number of Indiana companies that have participated in the PPE marketplace. We've received comments from folks who have received these packages and noticed that some of the materials are from overseas. And so I'm interested in knowing the percentage or ratio of how much of the marketplace's PPE materials are from Indiana, the United States, or overseas manufacturers. And then my second question for Governor Holcomb and Dr. Box, since the Back on Track plan was rolled out on May 1st, which will be exactly 1 month on Monday. We're nearly at 1,000 confirmed deaths in Indiana. So specifically, Dr. Box, I'm interested in some context for that number. And Governor Holcomb, I'd like to know if that particular milestone of an additional 1,000 dead Hoosiers gives you any concern for continuing as planned with the restrictions rollback, especially given the context about the potential emerging hotspots in Elkhart and Muncie.
First, second, third.
Exact percentages, we'll have to get back to you, but just want to be clear, from we are sourcing the materials from Indiana companies, and a majority of the products we have that we're using in the bundles are from Indiana companies made here in Indiana. There are limitations when it comes to masks right now about finding all American-made products, but we are working towards that. So on spots we are limited. In order to reopen the economy, reopen the state, we are sourcing from Indiana companies who are able to have that supply chain in providing PPE for the entire state.
Me?
Yeah, please.
Okay. So the deaths are actually almost 2,000 deaths, and one death was devastating. 2,000 is not even, it's hard to even describe the feelings. If you had asked me 10 weeks or 12 weeks ago that we'd be sitting here with this many Hoosiers who have lost their lives from this particular disease, I think I would have had trouble understanding that. It's been the hardest part of this job, quite honestly. When we look at it with regards to what we're doing, we're using data to look at this very carefully. And right now, our deaths and our cases are actually on the decline. Our hospitalized admissions are on the decline. Our ventilator access and our ICU beds have remained very stable. And so there is a point in time when there's not a vaccine that's going to be out tomorrow or the next day where we have to start to say, how can we safely reopen the state of Indiana? And how can we most protect those individuals that are at the highest risk, so that even as we open things back up, we still ask individuals that are at high risk to please continue to protect themselves. And that's why when I see individuals not wearing masks when they go into a particular store, or whether that's a grocery store or a retail store, I don't understand it, because that's a selfish way of behaving, because you may very well do fine. You may have asymptomatically, you may be carrying this disease, or if you get sick, it may be a runny nose or a little bit of a cough, and you may think it's allergies. But the elderly person that comes behind you may not have that same response to that disease. So I think that that's where we as Hoosiers can band together and help to make a difference here. When we talk about hotspots in Elkhart and Muncie, I actually had heard the New York Times had suggested Muncie was a rising hotspot, so I had my team look into that data. The bad news is they did have a spike of 5 deaths in one day on May the 21st, but their overall deaths have been 33, and that was an anomaly. Otherwise, their hospitalizations have gone down and their deaths have stayed very, very low. So I do not believe that taking 1 point of data and then expanding on that means that's a hot spot, and that is not what our data indicates. In Elkhart, we have said multiple times, and we've even looked at this with regards to the testing, that the high numbers that we're seeing is based on increased testing, and we know that increased testing, especially as we look at some of the populations that we have been targeting in Elkhart, like our Latino population, that those numbers will increase. And we are working with some particular industries up there that have been a part of this too. So to call that a hotspot, certainly we have more cases because of more testing and because we are engaged with more industry there.
Yeah, and I just add to that. Yeah, I'm concerned. I choked up on the first death as well, and every time I hear the report, not just read it, earlier in the day, but hear it, every single one of those deaths causes us to think, are we doing every single thing that we can do that is in our control to minimize those going forward? Obviously, this is not an either or. You don't just, as Dr. Bach said, you don't just look at one set of information. You look at everything, and we can do both. By the way, if we were to shut down completely all aspects of our life, there's a lot of collateral damage that will come from that as well that we'd have to address. And so the point is, A, we can do both, and B, I think we must do both safely. And we're proving that, and our actions have to change. And if you have underlying health conditions, you have to do things that others don't, quite frankly. But we're all in this together. That's, again, not just rhetorical, but when you think about those deaths and you think about, 1.4% under 60, and you think about the number, it's more like 13+% over 80. And so, yes, it disproportionately affects the elderly, but it's also the younger folks who are spreaders. And so our actions, our behavior, that's why we're not trying to be draconian here and just to say we're in charge. This is about passing on the best information that we have access to so that we can manage our way through this. So that you talk about 1,900, almost 1,950 deaths here in the state of Indiana in 3 months. There's been over 100,000 in America. This is global. And so how the bottom line is, how do we manage our way through it? And right now, as Dr. Box said, we are on the right track. We are moving in the right direction, even amidst the storm that's around us.
Thank you for joining today's briefing. Governor Holcomb's next briefing is scheduled for Wednesday at 2:30 p.m. Eastern.